Hi, I'm Dr. Matson. Today we're going to be talking about population health for nurses, specifically the foundation of public health and community health nursing. And we're following along in Chapter 2 of the Open Stacks textbook, Population Health for Nurses. What we're going to cover today is defining public health, looking at historical perspectives on public and community health, the importance of public and community health, the core functions and essential services of public health, and the levels of prevention. Public health and community health are two fields that work together to improve population health, which we covered in our previous chapter. So, public health professionals use research involving many people and large data sets to create policies and interventions. In community health, they work closely with community partners and local clients to understand health priorities. By the end of this lecture, you should be able to define public health, differentiate between upstream and downstream encounters, and contrast public health with population health. Defining public health, we're going to look at this in terms of the impact of the global health on domestic wellness. Public health nurses use lessons from around the world to keep people safe in the United States as nurses here locally. They watch for international health trends like measles outbreaks in Europe or tuberculosis in Asia, for example, and they share that information to help communities prepare. During COVID-19, nurses applied early lessons from China and Italy. They set up testing, encouraged vaccination, and explained safety steps in a way that fit each community. Public health nurses also support families who come to the United States as immigrants or refugees. For example, when families arrive from Afghanistan or Ukraine, nurses provide health screenings, connect them to local clinics, and make sure that care is respectful of their cultures. In all these ways, public health nurses turn global challenges into these local solutions that help in both public and community health. In public health, we often talk about upstream and downstream encounters. Causes of illness can be seen in two lenses. One lens looks at the system wide problem, things like poverty, pollution, or lack of access to healthy food that create unhealthy circumstances. The other lens looks at individual choices, such as smoking or poor diet, and can lead to disease. The metaphor of upstream and downstream was introduced by Dr. John McKinley in 1975. Downstream actions are defined as reactive steps we take after the disease has already developed. You can think about this in terms of treating diabetes or providing emergency care for those who've had heart attacks. Upstream actions, on the other hand, focus on prevention. These include community wide education, public health campaigns, and policies such as clean air laws or taxes on tobacco that reduce risk and support healthier lives. In summary, downstream treats the problem, but upstream intervention works to stop the problem before it starts. We're now going to look at the difference between population health and public health. Population health focuses on actions and initiatives of a healthcare system. It's emphasizing determinants of health like environment, social, economic, and educational domains, and assesses the health status of a population and identifies unique health challenges and designs interventions. Public health undertakes this collective action through society. So, this we can see in terms of organizing efforts in public policy, governance, and health services to advance the health of a population. Also, we can see implementation strategies and interventions at this society level. For this next section, after we go over it, you should be able to describe historical factors by the end relevant to shaping public and community health practice, and also talk about the textile industry as an example for understanding a historical and contemporary implication of public health. Events through history have inspired, shaped, and advanced public health fields. Noteworthy accomplishments such as the development of vaccines, sanitation, and waste management reforms, the formation of public health departments, and the introduction of health plan mandates have promoted public health as a specialty. Massachusetts and Louisiana were the first states to create a Bureau of Statistics and Board of Health. And Massachusetts developed the first state Board of Health with enforcement powers in 1869. In early 1900s, investigative journalism publicized unhealthy conditions. So that was the first time this was really being brought in a publicized way. The Industrial Revolution and the development of the modern public health system happened together. We saw this because the global Industrial Revolution began in the late 1700s. Production moved to using new machines, using steam and water power. This was a dangerous time for laborers with poor sanitation, overcrowding, and disease outbreaks. By 1860s, more than half of the workers were immigrants. Working and living conditions led to injury, croup, lung inflammation, bleeding lungs, cholera, scarlet fever, measles, dysentery, and brain inflammation. Reform movements began with the call for public health regulation. Here, what you're looking at in this picture is factory workers. So in the 1940s, so this picture is factory workers who are sewing garments in the 1940s. And this, even after the Industrial Revolution, the workforce of garment workers was comprised largely of women who did tedious work in ergonomically unfriendly conditions. The windows, if you're looking in here in this picture, you can see they're open, which is good. This greatly improved the spread of inhalation of dust and viruses and other airborne health threats. Also, take a closer look at this picture and think about what disease risk these women would have from working long hours in this environment. Public health in the United States from the 20th century to present. So today, working conditions are more regulated. Government agencies like the U.S. Environmental Protection Agency, EPA, support public health through policy and regulation, but the EPA may not adequately protect vulnerable people to these environmental threats. So public health policies and initiatives in the United States can be underdeveloped or underenforced, and we see that they don't protect all workers. Now we're going to look at this next picture. So this image, what you're looking at, is a large factory workspace with what appears to be adult workers. While the clean floors, if you're looking, it looks like there are clean floors, national light, perhaps give a positive impression. This workplace overall is challenging for health. This picture was taken during an official state government visit. And during these planned visits, these manufacturing facilities are often meticulously cleaned or even staged to shield the governmental officials from looking at unfavorable aspects, for example, child labor, forced labor, and unhealthy conditions. Unfortunately, this practice persists both domestically and abroad, where laborers work long hours for little pay. They are exposed to harmful chemicals. And there's more stories on this. Please look it up to become informed and kind of think about both local and global health impacts. When we think about this in terms of nursing work and how it's relevant to public and population and global health, we can see how nurses can intersect here into occupational health and even maternal and child health. And all these areas overlap, and we can work as nurses to address these health and textile industry challenges on both a public health, population health, community health way. When we're thinking about public and community health in emergencies, the most pressing contemporary community health issue can rise to a national or local emergency. So we see that the U.S. Surgeon General may issue warnings or advisories about public health. And professional organizations may also identify and declare public health crises. To qualify as a public health emergency, the health threat must be imminent, pose a significant risk to public health, and require a timely response. Public health emergencies span infectious disease outbreaks, natural disasters, and have pathological diagnosis among communities.
At 5 now, Mississippi has declared a public health emergency.
Here we're going to be looking at an example, and what I want you to think about is, what is the role of the public health nurse? Where can public health nurses make an impact in addressing this emergency?
After infant mortality rates hit their highest level in a decade. The state reports 9.7 deaths per 1,000 live births in 2024, with leading causes including preterm birth, low birth weight, SIDS, and birth defects. Health officials say they're launching a multi-pronged plan to expand prenatal care, strengthen community support, and improve programs for moms and babies, aiming to give every child a chance to survive and thrive. At 5 now, Mississippi.
Okay, now we're going to transition, and by the end of this discussion, you should be able to identify collaborative efforts across the United States public health system to improve the nation's health and explain the public health system's role in addressing population health needs. Additionally, you should be able to talk about public health funding and spending in the United States. This is a big topic right now as well in our lives, in our communities. It's going on. So it's important to be aware. Okay. So the public health system, it's this large interconnected network. There are leading organizations that work with local public health departments, including governmental organizations, nonprofits, colleges, universities, and community-based partners. I'm going to give you an example. So in San Diego State University, the Health Department of Health and Human Services at the public health level, so the local public health level, works with the Department of our University School of Nursing, Public Health, Exercise, Nutrition Science. We have a collaboration between San Diego State and the School of Public Health in San Diego. This is called the Live Well Center. And this collaboration also brings in community partners that are working with the county, and it's looking at workforce, learning experiences, research and data. And through these different efforts, interventions are created, programs are made, grants are applied for in order to really holistically improve health in the community. Public health functions like a large web of connections, and we often call this the public health system. So it brings together many organizations, government agencies, nonprofits, university, and community partners. So all these groups, they share data, resources, and expertise and work together to really improve local and national health and even global health. If we think about it in this way, if a local health department is addressing an outbreak in diabetes in the community, it might partner with the university for research, a nonprofit to provide nutrition classes, and local clinics to screen residents. So by combining all these efforts, this is how we create a stronger, more comprehensive response than any single group could achieve on its own. So this collaboration not only makes public health more efficient, but it also ensures that health problems are tackled in multiple angles. So even though some organizations specialize, for example, on may focus on heart disease, another on maternal health, the growing complexity of conditions means that we need to work together to address these issues in tandem. Funding. So public health professionals must be paid. There are lots of costs that go into these departments. Despite the budget need to run effectively, these programs have to have a return on investment. And when we see that we invest in the health on an upstream approach, this is preventing significant cost down the line. Nurses play a meaningful role in advocating for public and community health funding programs. Nurses are applying for grants, writing research programs. We've seen that grant funding has been stressed. The NIH is changing different protocols. This is a great opportunity for nurses' voices to be heard and to be in these different development phases and policy phases, and to advocate for the funding to improve health in communities and public health sectors. We want to strengthen health through collaboration. So this means in the United States, we need collaboration between federal, state, and local partners. So each play their own role. They have a distinct role that makes the system stronger. So the Center for Disease Control, CDC, collects and analyzes health data from all 50 states and territories. This is really helpful information to identify national trends, and this informs state and local action. It's a part of a lot of our research, and again, what we're using for background preliminary data or the need for funding. We're going to advocate it based on these trends that we're seeing in the CDC. The Healthy People 2030 initiative, this is led by the U.S. Department of Health and Human Services through the Office of Disease Prevention and Health Promotion, setting national goals and strategies. So these goals provide direction for the state and local health departments to align their program and policies. So we'll map this out based on a logic model and show what they're doing if it's improving health based on this. And again, this is tied to health outcomes metrics for the nation, and also used to secure grant funding as well. At the local level, the National Association of the County and City of Health Officials supports and represents local health departments. This can help formalize partnerships in several organizations, create channels for local voices to be heard, and share resources. And we spoke about it already, but the National Institute of Health, this is advancing research and directly shapes health practice, policy, and research in the terms of what people are looking to study based on the call outs for grant funding. So NIH collaborates with hospitals, clinicians, university, and community research sites to test interventions that can be scaled up and implemented across states and local governments. And just recently, they came out with this gold standard of trying to make all of the research align with this gold standard of being reproducible and being able to be implemented translational science in the communities in which they're serving. When the federal, state, and local governments share data, resource, and research, they can coordinate and improve health outcomes nationwide. So population health as a public health support, really, we see this in 4 different ways. So population monitoring and policy program development, illness surveillance and monitoring, emergency preparedness and response. So this is planning for emergency and developing response plans, preventing disease, promoting health, and reducing risk. Here, what you're looking at in this figure is public health policy efforts. So supporting population health can lead to smoking bans in public places. Please look at the difference between this on a national, state, city level, as well as the difference globally. Before the mid-1990s, smoking was legal in schools, restaurants, airplanes, and hospitals. And when indoor smoking bans took effect, it varied by state, but we saw health consequences in both smokers and non-smokers. We're going to be going over the 10 essential public health services. So by the end of this, you should be able to identify those and the core functions of public health and describe how the 10 essential public health services align with 3 core public health functions. So these core practices, the CDC identified 10 essential public health services that all communities should use. We start by assessing health in the community. So this is tracking trends, risks, and needs. And then we investigate problems and hazards. So this is diagnosing issues that put people at risk. We communicate early, so helping people understand what affects their health and what they can do about it. Mobilizing communities, so bringing communities together to take collective action. And we develop and put policies into place that create healthier environments. Also, we want to apply laws and regulations to protect people's safety and well-being and make sure that the systems are effective and accessible. Supporting a skilled and diverse workforce will allow us to meet community needs, and we learn to improve through research and evaluation, and this will help build stronger organizations with lasting health improvement. So these 10 are assess and monitor population health status and factors influencing health and community needs, investigate, diagnose, and address health problems and hazards, communicate effectively to inform people about health factors that influence and to improve it, and to strengthen, support, and mobilize communities, create, champion, and implement health policy, utilize appropriate legal and regulatory action, ensure all effective systems with equitable access to all, build and support diverse and skilled public health workforce, improve and innovate public health functions through evaluation, research, and quality improvement, and build and maintain strong organizational infrastructure. The three core functions of public health are assessment, development of policy, and assurance. So, assessment is collecting and evaluating data to monitor health trends, identify health disparity, injustice, and identify health problems that need intervention. Developing policies means working with lawmakers to ensure policies support public health, and assurance is facilitating systems that are actively working to ensure health is attainable for all. By the end of this next part, you should be able to identify and differentiate between the 5 levels of prevention public health and the efforts on one of these, on the differentiate public health efforts according to one of the 3 levels of prevention. So here, what you're looking at are the levels of prevention in public health. So we have on the very bottom primordial, and this affects populations by reducing the overall risk. Primary affects risk populations or environments by preventing problems. Secondary affects individuals by detecting conditions or needs, and tertiary affects individuals by preventing or lessening the negative impact. So if you think about this in terms of diabetes, we'll say we're going to start with our example of tertiary, so affecting individuals by preventing or lessening the impact. So your patient comes in, they already have diabetes. Now you're going to treat it with insulin, so it's lessening the impact, preventing any kind of damage to vision or limbs, right? Secondary would be you're a nurse in the community and you're screening for diabetes and you catch someone who has type 2 diabetes, and now you're able to detect it early. They haven't had a long time, so it hasn't had the chance to have these really negative health impacts, and you can get them to the right places in order to be cared for. Primary affects at-risk population by preventing problems. So here you could be looking at those with a family history of diabetes, educating them and having them be on a regulated diet even before any diabetes comes up. So you're preventing it before it actually happens. And primordial, this would be on the level of taking added sugar out of foods and implementing policies that only allow healthy foods in schools. So it's affecting the population by reducing the overall risk. So this is the same list, but on here you'll notice quaternary prevention. So this is protecting clients from health interventions that might cause more harm than good. So additional 5th level here. So overall, we define public health So health should be attainable for everyone. Public health is about making that possible. And it's not just about the hospitals and doctors, it's about organizing community efforts that keep people well. So you want to think about clean water systems, vaccine programs, seatbelt laws, all of those come from public health working in the background to protect the community. Historical perspectives, we want to look at how public health has grown out of history. So when cities in the 1800s struggled with cholera, sanitation systems were developed. When polio spread in the mid 1900s, vaccines were introduced. So we want to look at that as a reminder and think about how coordinated systems are in place to shape and deliver public health today. In terms of the importance of public health and community, so collaboration is needed to improve the nation's health, and different entities share data, resources, expertise, and programming to really comprehensively improve health. The core functions of public health and essential services we discussed. So we looked at the CDC and identified those 10 essential public health services. And then we talked about the different levels of prevention. So we went into that diagram of the 4 levels and then looked into that added 5th level there. So thank you for your time.